Hi, I'm Dr. Fred Echols, Acting Director of Health for the City of St. Louis. Over the past several weeks, I've been invited to several youth COVID-19 question and answer sessions. This week's segment is a summary of some of the questions I've received from the teens and children at those sessions. At the Boys and Girls Club of Greater St. Louis, Herbert Hoover site, I was asked, my mother purchased face masks with my back-to-school supplies. Why will we be required to wear masks at school this year? The Centers for Disease Control and Prevention recommends all students and staff wear masks inside schools, regardless of whether they're vaccinated. Masks are proven to be successful tools to slow the spread of the virus. With low vaccination levels among youth 12 and older and children under 12 not yet eligible to receive vaccines, we have to go back to one of the fundamental tools we have available to help ensure students and staff are safe. Another question I was asked at the Boys and Girls Club was, how effective are the vaccines? All three vaccines have shown to be effective in reducing the risk of severe illness, hospitalization, and death. Both the Moderna and Pfizer vaccines require 2 doses, a priming dose followed by a booster dose. The Pfizer vaccine showed effectiveness of 95% at preventing symptomatic SARS-CoV-2 infection after 2 doses. The Moderna vaccine was 94.1% effective at preventing symptomatic SARS-CoV-2 infection after the 2nd dose. Finally, the Johnson & Johnson 1-dose vaccine was shown to be 85% effective against severe disease. It is important to remember that the vaccines were created to prevent death and severe complications due to SARS-CoV-2 infection. In the city of St. Louis, minority populations, particularly African Americans, continue to account for nearly 80% of reported COVID-19 cases and 60% of deaths due to COVID-19 infection. At the Story Stitchers Dance Challenge COVID-19 question and answer session, I was asked, why have the COVID-19 vaccines currently being offered to the public not been fully approved by the FDA? All 3 vaccines being offered in the United States have received FDA emergency use authorization. Although this authorization is not FDA approval, the FDA conducted a thorough scientific evaluation of each authorized vaccine and can assure the public and medical community that the vaccines meet FDA's rigorous standards for safety, effectiveness, and manufacturing quality. Full approval looks at more data over a longer period of time. Another question I was asked at the Story Stitchers Dance Challenge COVID-19 question and answer session was, how did the vaccines get developed so fast? The vaccines were developed in record time when compared to the development of other vaccines. But there were 3 major factors that worked to the advantage of the COVID-19 vaccines. First, the pharmaceutical companies had a head start. Much research had already been done thanks to other coronaviruses, including the 2003 Severe Acute Respiratory Syndrome SARS outbreak and the 2012 Middle Eastern Respiratory Syndrome MERS outbreak. Second, lots of money was put towards the development of the vaccines. In the United States, under Operation Warp Speed, the federal government pledged close to $9 billion to fund the development and production of the vaccines. The final factor relates to the number of individuals needed for clinical trials. Typically, it takes years to get enough people with a particular condition to obtain the appropriate number of clinical trial participants and statistically significant results for clinical trials. Because millions of individuals across the world were infected and affected by SARS-CoV-2, the virus that causes COVID-19, that wasn't an issue. Thank you so much for tuning in this week. I look forward to joining you next week for more critical public health information. Let me hear from you, St. Louis. Please send your questions to health@stlouis-mo.gov. Questions will be answered in the order they are received. If I run out of time on air, your question will be answered by return email. Be well, St. Louis.